Moving on, and active aging hubs and senior activity centers under NTUC Health have resumed activities for the elderly since Monday, following guidelines from the Agency of Integrated Care. And that's after activities were suspended for about a month due to concerns over the coronavirus. For almost a month, 71-year-old Ho So-wah could only do some simple gardening work in his neighborhood. But he's since been able to join his friends at the Active Aging Hub at Kampong Admiralty after activities there resumed a few days ago.
We can do in the garden is only in the morning. At home, we are quite lonely. So if it's open here, then we meet our friends. We can share our ideas of this and that. We find ourselves more lively and merrier.
NTUC Health, which runs 3 of these hubs, says it's not letting up on precautionary measures which follow the Health Ministry's guidelines. While activities have restarted, these have been scaled down, limited to mostly solo activities and among smaller groups. These include reading newspapers, doing art and craft, or playing the glockenspiel. Seniors are also still required to practice personal hygiene.
We resume center activities for the seniors to encourage them to stay connected and engage to the community. We actually take quite a number of precautionary measures. We encourage them to wash hands, use a sanitizer, and then when they are doing the activity, we encourage them to stay 2 meters away from each other.
NTUC Health serves more than 3,500 elderly members in these hubs as well as senior activity centers. All activities were initially stopped on 10th of February when the DORSCON level was raised to orange. They had only been open for services like helping the elderly read letters or manage health appointments. Meanwhile, Touch Community Services, which operates 4 senior activity centers, says while activities are still suspended, they're still open to seniors who require assistance. For the elderly who require medical care in NTUC Health's nursing homes, measures have been ramped up. These include stopping volunteer activities to prevent potential spread of the virus.
So since DORSCON level has turned from yellow to orange, we have stopped all external volunteer activities. We also have do some COVID-19 sharing with our residents so that they are aware of what COVID-19 is all about.
To make up for the shortfall of volunteers, it's gotten its elderly residents to organize their own games and activities to keep each other entertained.